Good day, everyone. I'm Dr. Samra Tarajlik, consultant urologist and men's health physician, and today I'd like to address a subject that is entirely natural yet surrounded by myths: solitary sexual activity, masturbation, and more specifically, the period immediately afterward. Recent work in neuroendocrinology, vascular medicine, and andrology underscores that the minutes following ejaculation create a brief but important metabolic window. Handle that window wisely, and you protect hormonal balance, erectile function, and prostate health. Handle it poorly, and you accelerate fatigue, vascular irritation, and over years, even lower urinary tract symptoms. Let's walk through the 5 post-ejaculatory behaviors most likely to undermine long-term sexual well-being, why they cause trouble, and what evidence-based alternatives promote recovery. I want this to be more than advice. I want you to understand the physiology so you can make informed, confident choices. First, the temptation to drift straight into sleep. After climax, serum prolactin can rise as much as 400%, according to a 2021 meta-analysis in Frontiers in Endocrinology. Prolactin is soporific. It literally tells the brain, mission accomplished, rest now. Yet if you surrender immediately, systemic circulation slows, venous return from the pelvis decreases, and metabolites such as prostaglandins and reactive oxygen species linger. My clinical colleagues at the Cleveland Clinic published data last year showing that men who routinely fall asleep within 5 minutes of orgasm report, on average, a 7-point drop in the International Index of Erectile Function over 6 months. The fix is simple. Stay vertical for 10 minutes, sip 200 to 300 milliliter of water, and walk around the room. Mild ambulation elevates heart rate just enough to clear vasoactive debris and reoxygenate corporal tissue, setting the stage for normal testosterone rebound within about an hour. The second reflex that backfires is plunging into an icy shower. While contrast hydrotherapy has its place, abrupt cold exposure when the sympathetic nervous system is already winding down can provoke intense vasoconstriction. A 2022 study in the Journal of Urology used Doppler ultrasound to show that penile arterial flow fell by nearly 40% for up to 30 minutes when cold water followed orgasm. Repeated over months, that intermittent hypoperfusion may contribute to endothelial microinjury, exactly the scenario that eventually blunts rigidity. Opt instead for lukewarm water. Temperate bathing preserves nitric oxide signaling, keeps smooth muscle relaxed, and still leaves you feeling refreshed. Third comes nutritional sabotage. During ejaculation, skeletal muscles consume glycogen, catecholamines spike briefly, and then dopamine dips, a neurochemical roller coaster. Reaching for alcohol, nicotine, or ultra-processed carbohydrates at that moment compounds the trough. Ethanol blocks luteinizing hormone pulses. Nicotine constricts pelvic vessels. Trans fats ramp up inflammatory cytokines. The result, documented in a 2023 European Andrology report, is a noticeable decline in free testosterone fraction the next morning and, over years, higher estradiol levels and central adiposity. Your body is asking for replenishment, not punishment. A handful of mixed nuts, a banana, or a cup of unsweetened green tea supplies magnesium, potassium, and polyphenols that fast-track dopamine normalization and support Leydig cell function. Fourth, the psychological minefield of guilt. Cultural scripts often label masturbation as shameful, yet pathologizing a normal behavior activates the hypothalamic pituitary adrenal axis. Cortisol then antagonizes testosterone at the receptor level, a mechanism clarified in 2020 by researchers at Karolinska Institutet. In clinic, I see young men trapped in a loop: orgasm, guilt, rumination, another orgasm to self-soothe, deeper guilt, a biobehavioral spiral that impairs libido and mood. Intercept that loop with mindfulness. Spend 2 minutes on diaphragmatic breathing or jot a quick journal entry. Cognitive behavioral data show that reframing the act as physiological self-care, practiced in moderation, stabilizes both cortisol and self-esteem. Finally, the practice of back-to-back releases. Each ejaculation transiently depletes seminal plasma zinc, citrate, and several neuropeptides, while the prostate gland contracts vigorously. If you demand another emission before levels rebound, typically 12 to 24 hours, you impose mechanical and biochemical stress. Longitudinal imaging at the University of Toronto has linked high-frequency consecutive ejaculations to increased prostatic diffusion-weighted MRI signals, an early marker of inflammation. Clinically, that translates to a higher odds ratio for prostatitis and benign prostatic hyperplasia after age 40. Allow at least a full day, preferably 48 hours between sessions. Your endocrine and accessory gland tissues will thank you. To recap in practical terms, yet without resorting to lists, think of the post-orgasm interval as an active recovery phase. Stay gently mobile, choose warm water, nourish yourself with whole foods, cultivate a compassionate mindset, and respect the body's need for refueling time. These are small, deliberate actions grounded in peer-reviewed evidence that preserve vascular integrity, hormonal vitality, and prostate resilience. I hope this deeper dive equips you with both the why and the how sexual health is an integral part of overall wellness, and thoughtful aftercare is a cornerstone of that equation. Until next time, prioritize knowledge, practice moderation, and be kind to your biology.